Great. Well, thank you again, Sylvia. Hello, everyone, and welcome to our webinar titled Food RX Programs for Health Equity. A little bit about the National Center for Farmworker Health. Today's webinar is hosted by the National Center for Farmworker Health, and we're a private, not-for-profit organization located in Buda, Texas. And our mission is to improve the health of farm worker families. We do this through population-specific data, resources and technical assistance, workforce development and training, health education resources and program development, board governance training, and program management. Today's learning objectives include identifying the key features of a Food RX program, understanding the correlation between food insecurity and chronic disease, identifying the three main types of Food RX programs available to you and that you may want to consider if you're initiating a Food RX program, and implementing strategies to initiate partnerships with community-based organizations or businesses to address food insecurity in your patient population. So what is Food RX? Now, just a quick note on naming. We're using the name Food RX for the purposes of this presentation, but these programs can go by the name Produce Prescription Programs or Fruit and Vegetable Prescription Programs. These are innovative cross-sector programs that can draw on the strengths of healthcare, retail and markets, nonprofit, government, and even education. These programs distribute produce and other healthy food staples to patients who suffer from diet-related diseases, such as prediabetes, diabetes, and hypertension. And they offer a promising solution to the compounding issues of food insecurity, rising healthcare costs, and ill health, all of which are issues I'm sure many of you are concerned about in your patient populations. So what are the benefits of a Food RX program? I'm actually going to pose this question to you all, and I'm curious what your thoughts are. So I'm actually going to start sharing this window. You'll see a URL and a code to enter, and Maria is going to enter a link that will be in the chat that will take you directly to the site. And when you get to the site, there will be a list of slots where I'd like you to share, what do you think are the benefits of a Food RX program? And as you enter them, your answers will populate in this word cloud. So let me know if anyone is having trouble accessing this.
If for some reason you can't access them through Menti, feel free to respond in the chat box.
Yes, we already see some answers coming in. And by the way, there is the ability for people to answer multiple times. So if you think of more than one answer, feel free to go ahead and enter it in. Wow, it's neat to see this continue growing. So we have folks saying healthy families, nutrition, increased food access, reduction in chronic disease, exactly, decreased stress. Yeah, we'll talk about that. Survival, right? For some folks, this type of program might allow their actual survival. Improvements in diabetes, for sure. Decreased hunger, mental clarity. Yeah, I don't know about y'all, but personally, when I'm really hungry, I am not thinking clearly, right? So increasing access to healthy food could totally help you think clearly, improve your mental health. Yeah, less depression. Food that supports culture. Yes. Kids are healthy. Well, I'll let y'all continue to add to this word cloud. I think it's really neat to see it change as our understanding of these benefits of a Food RX program changes. But in the meantime, I'm going to stop sharing. I don't want to stop sharing because it's cool to see. But I'm gonna stop sharing. And while I switch my screens, I also wanted to just call out one person shared educational improvements, which I thought was an interesting benefit as well. Here we go. Okay. So honestly, I think that y'all covered all of these benefits, but I just want to sort of rehash a couple of the ones that have been better documented when it comes to Food RX programs and when researchers study these programs. So a couple of these benefits include improved blood pressure, reductions in body mass index scores, a reduction in hemoglobin A1C levels in individuals with diabetes, decreases in food insecurity. And this is another one that a bunch of y'all got to that I was happy to see, decreases in depressive symptoms and improvements in overall health management, and improvements in patient-provider relationships. And this last one is one of the major benefits that we saw when we were studying Food RX programs around the country, and one that we'll get back to in just a couple of minutes. So now that we know what Food RX is and how it can benefit your patients, you may be wondering how a healthcare organization can take part in resolving the issue of food insecurity in your patients. So part of this may be because although we see that Food RX can have many health-related benefits, this type of intervention is relatively non-traditional for a healthcare setting. And so we want to make that connection really explicit between food insecurity and the chronic diseases we see so often in patients. So first thing we need to understand about the connection this connection is that food insecurity, stress, and chronic disease incidents all build on each other to create even worse effects for patients in many instances. And this is because people who are food insecure have low access to the types of healthy foods that can help them avoid and manage chronic conditions like fruits, vegetables, and healthy staples like whole grains, proteins, legumes, etc. Right? Another factor to consider is that when patients are food insecure, they may have a hard time affording high quality foods and buy less expensive foods or foods that are more shelf stable, right, to make their budgets last. And these foods can also be high in sugars, salts, and fats that exacerbate these conditions. And finally, we see elevated levels of stress in these individuals associated with the lack of security they have in feeding themselves and their families. And as we know, stress can be a complicating factor for many of these diseases as well. So as more and more health systems shift towards a value-based care model, health centers are increasingly being asked to improve social determinants of health, improve overall health, and keep their costs down. And Food RX can be an effective way of addressing each of these, right? Food insecurity as a social determinant of health, it improves the measures that we discussed earlier, and it can save on costs by mitigating or avoiding the health complications of food insecurity. And in one study, the researchers found that giving Medicare and Medicaid participants a 30% subsidy of the cost of produce over their lifetime would result in $39.7 billion in healthcare savings nationally. So just imagine what kind of impact these programs could have. Now we're going to move into exploring the different types of Food RX program models. So as we were looking across the country at the diversity of food RX programs, we found that there are three main types. The first is voucher programs, the second is food delivery programs, and the third is referral programs. So first we'll cover voucher programs. Voucher programs are at their core a partnership between a health center and a produce partner. And just to clarify, we use the term produce partner to designate the organization that supplies the fruits and vegetables in partnership with the healthcare organization. So in this model, the health center identifies the patient needing food assistance, they provide a voucher or a coupon, and they refer them to the produce partner. The patients then cash in their vouchers or coupons for fresh produce and other healthy food staples. And a couple of common venues for this type of model include farmers markets, farm stands, grocery stores, or native trading posts. And actually, just one more note on vouchers. We're seeing more programs move to this model due to the amount of choice it gives patients over food options. And today there are options for both physical vouchers or electronic vouchers, which can save organizations a lot of time in tracking and sorting the circulation of vouchers. So next we'll cover food delivery programs. Food delivery programs are a partnership between a health center and a produce partner who directly delivers the produce to an identified location. In this model, the health center identifies the patient and refers them to the produce partner. The partner then delivers the produce either directly to the patient's home or to a centralized location, like a school, a faith-based organization, or the health center itself. The patients then receive their produce or other healthy food staples at this location. And examples of these types of programs include CSA box distributions. So CSA stands for Community Supported Agriculture, which are usually boxes of produce that local farms have grown fresh. So this can be a great way of giving patients a variety of fresh produce while also supporting local agriculture. And other types include mobile markets or food pantries. And one benefit of food delivery programs is that this can work well for patients with limited mobility or transportation, especially if the produce is delivered to their door. Lastly, we'll cover referral programs. So referral programs can be a good option for health centers and organizations with limited resources for starting their own produce distribution. In this model, the health center identifies the patient, connects them to an already existing source of free produce, and integrates the referral process into their workflow. And examples of this type of program could include referrals to food pantries, especially food pantries that have a good selection of fresh produce and healthy food staples that are low in sodium, added sugars, and saturated fats. Another could include a referral to Double Up Snap, which can be found at many farmers markets and healthy food retailers across the country. And this is when participants present their electronic benefit transfer cards or EBT cards, and their SNAP dollars are doubled for purchases of fruits and vegetables. And one final example is the WIC cash value benefit, where WIC purchases are similarly given an added benefit for fruits and vegetables. So now that we've explored the program models at your disposal, we wanted to cover what one of these programs could actually look like in your organization. We wanted to highlight a program here in Texas, which is a partnership between Pasadena Health Center and the Houston Food Bank. The way that this program works is that Pasadena Health Center screens patients for food insecurity. Then, since this is a food distribution type program, Houston Food Bank's mobile truck comes directly to the health center on a biweekly basis. One change that happened in the market due to COVID-19 is that instead of patients moving through the truck themselves, patients are greeted in the parking lot, and then staff and volunteers collect survey responses and their food choices via a tablet. And then from there, the volunteers put together their baskets and hand deliver them to the patients, rather than the patients actually coming through the truck themselves. So patients receive a total of 30 pounds of fruits, vegetables, pantry staples, and frozen proteins. And these images that you'll see here on the right are actually what a food distribution looks like at Pasadena. So in this top photo, you'll see some of the selections of fruits, vegetables, and pantry staples that they receive. And then this lower picture is actually the inside of the truck, and one of the volunteers who helps out regularly. So from a more clinical perspective, this is what the workflow looks like for an individual patient within the FoodRx system. So first, patients are screened for food insecurity. You'll see starting up here on the top right. And they're screened using a 2-question screener, and the results are entered into the electronic health record. Then a combination of food insecurity and prediabetes, diabetes, hypertension, or obesity triggers a referral to the FoodRx program in the electronic health record. Then a treatment plan is created for a patient. Next, the provider speaks with the patient about food insecurity. Then a community health worker educates the patient and enrolls them into the FoodRx program. And for the next 3 months on a biweekly basis, the patient receives their FoodRx from the Food for Change Market through Houston Food Bank. Food for Change Market is the name of the truck distribution system that they have there for FoodRx. And then in order to maintain eligibility for the program, they must remain a patient at the health center and complete their checkups every 3 months. And as long as they meet this eligibility criteria, the patient continues to receive their FoodRx from the Food for Change Market. In terms of the benefits of this partnership between Pasadena Health Center and the Houston Food Bank, there were a total of 242 patients enrolled in the program as of the end of last year. And during the last quarter of 2021, 534 food bags were distributed, which was a 28% increase from the previous quarter. So we see that there is growing recognition of this program. The health center reports that they've seen improvements in the relationship with their patients, especially in the trust their patients have. And patient interviews report an increase in disease management behaviors and well-being. So now let's learn more about the practical steps to getting started with your own FoodRx program. The first step is to assess your organization's readiness for initiating this type of program. We've prepared a couple of questions to give you an idea of if your organization is ready. So Sylvia, will you launch the first poll? So you should see a poll question populate on your screen. And these are just a couple of questions to basically assess, is your organization prepared for initiating a FoodRx program? So our first question is, does your health center currently screen for food insecurity? So you'll select yes, somewhat, or no, and then submit your answers. So I'll give everyone just a minute or so to complete the poll. And, this asks, does your community or migrant health center currently screen for food insecurity? But if you're a different type of healthcare organization, or maybe you partner with one, maybe answer it based off of, does that organization screen for food insecurity? Okay, so we got a lot of yeses, some somewhats, and some nos. So if you answered yes to this question, you're probably already collecting data on how many of your patients are food insecure, and you're seeing if there is a true need for this program. If you answered somewhat or no, maybe you're interested in learning about how many of your patients are experiencing food insecurity, but you haven't made it part of your process yet. And doing so can be a great first step in determining how great of a need there is for this program in your organization or in your community. So Sylvia, you can go ahead and launch the next one. So the next question is addressing food insecurity a priority for the leadership of your organization? Again, the options are yes, somewhat, and no. And I'm curious as well, and I wonder if you wouldn't mind sharing in the chat, if it is or if it isn't, let us know why. If it is a priority for the leadership in your organization, why is that? What have you noticed in your community? And if not, what is the reason for that? What are some of the limiting factors that maybe don't allow you to address this? Okay, so we got, again, more than half of folks saying that yes, food insecurity is a priority for the leadership in their organization. And then many also answering somewhat or no. And we have one person in the chat sharing that their community has a lot of food insecurity. And so, yes, it is a priority, right? So this, I agree, absolutely. So this is one of those issues that once you realize it is an issue and it is prevalent in your community, it's a hard issue to ignore, right? Another person shared, it is because we are one of the only health centers that takes Medicaid. We try to treat every single person that comes into our office, whether they have secure resources or not. Right. So if that is the situation that your health center is in, you might see more food insecure folks than other healthcare organizations would, right? And so food insecurity might also be more of an issue for the chronic diseases that your patient population faces. Someone shared that it's difficult for providers to remember to ask. It is not set in workflows. Yeah, so this is something that we see a lot with organizations as they're first starting to implement FoodRx is the screener questions, right? Which is actually what we're going to get to next. And when it's not integrated in your workflow, it can be really hard to remember to implement. Yeah, someone else shared our food center or our health center is in a food desert, right? So that means that there is very low access to healthy foods in the community, right? Or people might not have the means to actually access those healthy foods. Great. It's really great to see some of these come in. Okay. So Sylvia, speaking of our screener questions, if you could go ahead and launch our next poll. So do staff understand the relationship between food insecurity and chronic diet-related diseases? Sorry, I think we already asked the one on the screener questions. But yeah, so hopefully now that you are attending this training, hopefully, yes, your staff does understand a bit more the relationship between food insecurity, but I'm curious, you know, maybe before this training, was this something that your staff was aware of, that there's actually this link between food insecurity and chronic diet-related disease? And I'll give everyone another minute to answer. Okay, so again, over half of folks saying that yes, staff do understand that relationship between food insecurity and chronic related diseases, which is great to hear, because, you know, understanding that relationship is one of the first steps in getting started and actually resolving these issues, right? And again, hopefully after attending the webinar, you'll be able to answer yes to this question. But if you answered somewhat or no, who are these key people within the organization that could benefit from learning more on this topic? By identifying these key areas for improvement, you can turn some of these somewhats or no's into yeses and consider starting your own program. And, you know, maybe if there's key folks within the organization that that could benefit from learning more about this, maybe share this recording with them, right? And allow them to learn a little bit more about that connection. Okay. So once you have determined that your organization is prepared to start a Food RX program, you'll want to assess what kinds of organizations are available in your community to provide produce, coordination, and perhaps nutrition education. You'll also want to assess if these organizations are well poised to partner with you on this project, right? So you'll want to look around your community and assess, are there produce partners available, right? Are there organizations, all different kinds, whether they be nonprofits or growers, farmers markets, right? Is there someone in the community who is able to provide the produce? Some programs choose to have an organization like coordinating the program, so they have someone who's kind of a liaison between the two organizations. And perhaps if you don't have the capacity to do the nutrition education in-house, sometimes there's higher ed organizations or other community organizations that can support you in that nutrition education aspect. And again, just like you've now assessed your organization's readiness on a couple of points to see, are you ready for this type of project? You'll want to do the same with these other organizations to see if they have the capacity and the understanding to initiate this type of project. I also want to urge you all, please don't be afraid to reach out for assistance, whether it's in selecting your screener questions, assessing the readiness of your organizations, selecting the best type of program for your organization, or any other questions that you could possibly have about the process. We would be really happy to hear from you. And if you are interested in learning more about Food RX, we have a variety of resources available. For one, I would urge you to check out the Nutrition Incentive Hub's 2022 National Convening recordings, where you can learn more about the ins and outs of Food RX and also hear from a variety of organizations around the country who have implemented these programs. And then in the fall of 2022, we will be having a follow-up to this webinar, including more practical steps to getting started with your own program. And then stay tuned as well for upcoming FoodRx resources and tools this year, because we have a lot of exciting things in the works. So if you would like any assistance or have any questions, feel free to reach out. You can find my contact information here. And I will take a moment just to leave this slide up in case you want to write anything down or take a screenshot. And before I turn it back to Sylvia and we get to our Q&A, I would like to thank you all so much for attending our webinar today on FoodRx programs for health equity. And if you're watching the recording, thanks for watching. If you're here with us today, it's been a huge pleasure being here with you all. Thanks again, and back to you, Sylvia.